Hi, I'm Dr. Julie Steinauer. We're going to talk to you today about a difficult topic, but we're going to try to do it with grace because the most important thing is that you learn and understand that various medications, whether you take them by mouth, apply them by patch, or you're injecting them, can cause visual problems that you need to be aware of. Now, if you're local to us and you want to call us at 618-288-1489. If you're not local and you're somewhere else in the world but you want to discuss what's going on with your vision, you have two choices. Go to our website at visionforlifeworks.com. You can either fill out a questionnaire or you can click schedule a consultation with me, particularly if maybe you've been following me for 6 months to a year and you're just, wanting to jump right in and work with us. All right, now let's go back and talk about these medications that can alter your vision. So I want to discuss some symptoms for you to be aware of, when to contact your doctor who prescribed them versus when to go to an eye doctor or even the emergency room, and when to contact us for therapy. Okay, so those are kind of my three things. There are many medications, whether again you take them by mouth, they're injectable, or you've used a patch, that could potentially cause you problems with your vision. You just need to be aware of them. And some of these things that you want to be aware of are, does it cause blurry vision? Eyes that feel dry, scratchy, or irritated? Do your eyes actually hurt, like a deep aching in your eye? Are you having problems with light sensitivity? Have you developed double vision? Okay, do you feel like you can't move your eye in a particular direction, or possibly even you've developed a blind spot in your vision? Right, so times to kind of go to your doctor first and say, hey, prescribing doctor, we might need to alter something. Maybe you're having problems with focusing and it's kind of blurry, or eyes are kind of scratchy or feel kind of dry. Those are times you want to go back to the doctor and say, or even maybe feel like you're seeing weird things, like things kind of look like they're wavy or something weird with my eyes. Contact the prescribing physician and say, hey, we might need to change. Maybe you need to go to a different medication. Maybe you need to adjust the dosage in your medication. Okay, if it's something like a patch, maybe you need to take it off and not use that anymore. If it's an injectable, unfortunately you can't undo that. So you definitely need to talk with your doctor, but there's more steps involved with that one. Now, let's say, when do you go to like the emergency room and just skip your general prescribing doctor, or go to an eye doctor direct? So if you've developed double vision and it's kind of not going away, but all of a sudden you're having double vision, it's like a constant double vision, or maybe you're seeing spots or blind spots in your vision, those are times you do not want to just let that go and kind of see what happens. Go to an eye doctor, go to the emergency room immediately, especially if you have other signs, like maybe you're having heart palpitations, or tachycardia where your heart races really fast, or even bradycardia where your heart kind of is slow. Anything that you feel like sweating, or something else that you're like, man, my body, there's just something wrong. I am not right. Those are times that you want to go, either direct to like an emergency room, or you want to go to an eye doctor if it's vision related with like double vision. Now, when do you contact us? Okay, so let's say that you've been through all of those other chains of command and you've either altered medications and it's not changing. You have these problems now. Or let's say that you have, it was an emergency and you went to the emergency room and they've ruled out everything, but now you're having double vision. And now you learn that your eye's turning, right? And they've ruled out stroke or traumatic brain injury, right? So if those things have happened and now you're stuck with whatever the result is, well, now it's time to contact our office, because now we're knowing, all right, you've taken care of yourself medically to make sure that you're safe and that you're not in a danger zone of potentially having a stroke or a heart attack or something else. Then now come to us, okay? Maybe you've even ruled out like a brain tumor. All right, now come to us, because now what we want to do is we want to see what we can do to help restore your vision and to get the clock turned backwards if we can with what happened to you because of your medication. Now, please realize we're not telling you don't take your medication. What we are saying is there's tons of medicines, mood-altering medications that maybe you need because of depression or anxiety. Medications that you might need for say hypertension even, or like if you have lupus or MS, medicines that you may need to have but can cause problems with your vision. Okay, and maybe you've done something like you took, a patch for something, or you did some sort of injectable treatment. And those things, obviously, they can't be reversed, but now you have some vision problems. We understand that, and we know that, again, if you've gone through the chain of command with your other doctors to have things looked at, now if it's like a last result that you're trying to deal with, we are going to step in and give you a plan of action. Maybe that includes going through detoxification of your brain or your body or something that would potentially help improve your vision. Maybe it's adding supplements to what you're doing, with diet and exercise that could potentially benefit you. We work with a doctor who can provide those things. We don't provide supplementation advice, but we do work with a doctor who can add that no matter where you're at. So if you're local or non-local to us. So please take these changes via medication to your vision seriously. Don't ignore them. And again, do the proper thing that I mentioned. Either contact the prescribing doctor first if it's mild. Okay, if it's very serious, just jump into seeing an eye doctor or go to the ER. And if you've done all of that and you've got these lasting results, we know you've done everything you can to take care of your health and your vision, but you still have these problems that now we need to rectify. Then reach out to us. Contact us if you're local at 618-288-1489. If you're not local, you can go to our website and do one of two things. You can either fill out a questionnaire, which will come to us and we'll email you, or if you just want to schedule a consultation direct with me, then click the button, schedule a consultation. Now, this video is kind of a tough one, but it is necessary to talk about. And if you know someone who could benefit by it, please pass this video along. We'd love it if you'd hit the like button, subscribe to our YouTube channel, and if you haven't, click that bell icon to subscribe to all of our videos. Do that so you get notified for everything, because we put out all kinds of good, valuable, and awesome content. Now, if you, again, want to contact our office, you have a couple of choices. If you're not local, you can still connect with us. Rewind and go back and watch. There's multiple ways that you can connect. All right, thank you.